That's not the only way to access peer support. So another really important way is simply to approach someone who you know is a peer supporter. Do you mind if I have the peer supporters who are in the room who are trained, just raise your hands? And I know a couple of people who were here have left. So we have at least 2 who are here. And I think there are folks on Zoom who might also be. So if you're on Zoom, do you mind unmuting yourself and just saying who you are, if you can? Or you can put it in the chat and we'll read it out. What? It's possible. It's possible none. So, so there are folks who are trained. And like I said before, residents and fellows occupy, as you mentioned, especially junior residents, but not only junior residents, occupy a particularly vulnerable group where they're early in their careers. And so the things that happen can be really particularly impacting. We do have a number of residents trained in peer support. I can't remember I don't think we have any residents from OB trained right now. So if you're interested, that would be wonderful. But we do have residents in other departments trained, both procedural and non-procedural fields. And then finally, the last thing I would just say is peer supporters often activate themselves. So this is exactly the kind of support you were talking about, where you know that something difficult has happened. You see someone who's struggling or distressed, and you just reach out and start a conversation. And they might accept it. They might say, I'm good right now. That's fine. Both are okay. That's Brian. Oh, yes. And peer referral. Thank you, Brian. So peer referral is what Brian was mentioning before. Like if he knows that I've experienced a difficult case and he's not in a position at that moment because he's say about to travel or he's really busy or the peer support doesn't fit in at that moment for him, or you're not a peer supporter. Yes. He might reach out on my behalf to the peer support program and say, I think she was involved in a difficult case. Could someone reach out to her? And we get a lot of those to the peer support in basket, actually, but for all types of members of our healthcare teams. And we follow those up with outreach to those folks so we can connect them with supporters if they wish to do that. So let's go back. We've got a couple minutes to finish up, and then I think Brian will stay for questions for a little longer than I'll be able to because I have a patient at 9 o'clock. These things happen. But I just wanted to, as you're sort of digesting what we've been talking about, what surprised you about today? What resonated particularly with you? And are there takeaways that you have? And in Zoom, if you'd like to enter things in chat, maybe someone, or unmute yourself, someone could also read those out of chat. And you can ask questions as well if you'd like. Thank you for the mic help out there.
I guess I just want to thank you for doing this. I think this is really important. I've personally used the peer support and was super impressed with how quickly, like you said, hours. I emailed them, I think at noon, and got something by 4 p.m. on a Friday. And I thought it was really helpful. I actually didn't know residents could be trained, so I'll be reaching out about that. I think it's really great. So thank you for bringing this to the attention of the department, because I think it's the structured part is important, but I think just recognizing the informal process in the level 1 is really important too. So thank you.
Thank you for that comment.
I also want to start by just thanking you both for accepting the invitation and really taking it on and sort of building something that hadn't completely existed before. This kind of 2-part training that I think could be really great. I want to comment on, our department and the fact that, like, you did it, you guys were ahead of it in ED because it's so obvious in ED, the need for this. It's just as obvious in OBGYN and, especially I think, obstetrics, ICU care, and these really dramatic events happen so often that we minimize the impact regularly, but there's a huge impact. And the more you talk to providers, the more you see it. So we're a little bit behind the 8 ball. We've realized that. I think, Ellen's comment about wanting to make it an important thing moving forward is something we absolutely have to do. And that's what this is. This is the start of that. So yes, we've had some peer supporters in the department. Yes, the program's been available to us all along, but we haven't taken advantage of it in a systematic way, the way we really should. And what we're hoping is with this introduction that people will be interested in becoming trained, You'll hear more about the 12-1 session. It's optional, but that's something that anybody in the room can do. And then what we're hoping after that is that we determine what kind of a system we want in our department. So we could just have more trained people and then tap into it. Or we could come up with something a little bit more robust, like what they have in the ED, and we can start discussing that. So it's the beginning of, I think, a new phase for our department that I think we've needed for a long time.
Yeah, thanks, Dave, for that comment. I think I would agree wholeheartedly that with your first comment, I think obstetrics and gynecology is certainly one of those really high risk fields and just inherent to that patient population and the nature of the work that you all do. And I think that, the literature would back that up in terms of those fields, that are at highest risk. So I think certainly could understand, I think, the value of that. And I think, what's nice about the structure of kind of the program that we've set up here is, it's kind of that base or that foundation. And then there's that opportunity for individual departments or areas to kind of take that base and build on that. And that's, where it's been nice to kind of fold the ED program into the larger UW Health peer support program. And each department is going to have inherently different needs and, variations on kind of how their structure is. I know we talked about that already, the complexity with Meritor. There's just going to be certain nuances. And so, we see that across different anesthesia is structured very differently. And I think there really is that opportunity though to build on that foundation that this program offers and take that as far as in whatever ways kind of you guys want. So.
I absolutely agree with that. Any more questions or comments?
You need to go.
And then I need to go, which is really sad because I would like to stay.
Oh, I can do it.
Brought to you by.
Maybe. Whoops.
Attendance for this hour, text POHDOX.
I'm gonna make you guys dizzy.
Oh, there it is, DOX. Thank you.
I think Mariah needs to go to attend to patient care, but any other questions you guys have? Otherwise, I can also just stay and answer some questions up front if you guys have any.
And I'll just add, because I am about to head out, I am happy to hear from any of you. My email address is maquinn@medicine.wisc.edu. Please reach out if you have any questions or anything well-being associated. And also just one plug, provider well-being survey running right now. OBGYN residents, we could use some more responses. Please take the survey because it really helps us know how to structure things to help you guys better. And it is a complicated scenario given that you're practicing a lot of time at Meritor. So please respond. Email me with questions.
Yeah. Anything else? Otherwise, not seeing any. I think we can maybe wrap up here. So thank you all again for coming today. And thank you all that are online as well. I really appreciate the opportunity for Dr. Quinn and myself to present on this today.